we'll be discussing the cardiac function curve and the vascular function curve. Cardiac function curve is the relationship between cardiac output and the right atrial pressure and end diastolic volume. So the relationship of cardiac function curve goes like this. Now the relationship between the venous return and the vascular function curve, it is the right atrial pressure and the end diastolic volume, which is like this. The point at which the vascular function curve intercepts with the right atrial pressure, this is the mean systemic pressure. Now the cardiac function curve, will be seeing three different situations: the effect of cardiac function curve and vascular function curve by entropy, the first, and we'll see the effect of venous return and the effect of total peripheral resistance. The effect of entropy is increased on the contractility of the heart. When the contractility of the heart increases, the cardiac output increases, and when the entropy decreases, the cardiac output decreases. The increased entropy can be due to catecholamines, digoxin, and exercise, whereas decreased cardiac output can be due to heart failure with reduced ejection fraction, narcotic overdose, or sympathetic inhibition. The effect of entropy is not seen on the vascular function curve. The effect of venous return on cardiac function curve is not seen, but it is seen on the vascular function curve. The vascular function curve decreases when the venous return decreases, and increase when venous return is increased. Increased venous return can be due to fluid infusion, sympathetic activity, and reduced venous return can be due to acute hemorrhage and spinal anesthesia. The total peripheral resistance affects both the cardiac function and the vascular function curve. Increased total peripheral resistance due to, example, vasopressin, will move the cardiac function curve upwards, and decreased total peripheral resistance, example by exercise or AV shunt, brings the cardiac function down. And increased peripheral resistance affects even the vascular function curve, but it does not change the mean systemic pressure. Now when you combine all of these graphs, you combine the cardiac function and the vascular function curve, the point of interception is called the opening point of the heart, and this, on increased entropy, shifts the operating point of heart upwards, and decreased entropy shifts the operating point of heart below, and it shifts the increased venous return shifts the operating point of heart forwards, and decreased shifts it downwards. The effect of total peripheral resistance is seen on both, so it shifts it upwards and backwards and downwards. Now there can be combinations of both increased entropy and decreased venous return, which changes the heart.